Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Ian Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Premier.
Thank you, Heather. We are reporting one new case today, and there were 5 cases over the weekend. Several cases are under investigation. At this point, though, there is no sign of community spread. But this is also a sure sign that we are not clear of COVID, and we must continue to be vigilant against the virus. Our best defense is the vaccine, and I want to thank everyone for getting out to get their shot. We now have 75% coverage for first dose, and we're at 41% coverage for second dose. So we're not there yet. We still have a way to go. Our walk-in clinics are proving to be successful. We're opening a number of our community clinics for walk-in service, and we're expanding our clinic coverage. But I want you to know we are doing this because we need you to get your second shot. We are concerned there may be a number of people holding out for the Pfizer vaccine. Please don't wait. We don't have a large shipment of Pfizer coming in, and what we do have must be reserved for 12 to 17-year-olds who can only take Pfizer. Moderna is proving to be very effective. That's why I had Moderna for my second shot. There are many vacant appointments this week, so those people who can move up their second dose appointments, please do so. And Dr. Strang will have more to say about this, but the bottom line is the most important thing you can do is get out to get your second dose of vaccine. It protects you and those around you. So please book an appointment or go directly to a walk-in clinic. Exciting news today, we are moving into phase 4 on Wednesday as planned, and we need everyone to do their part as we move into this next phase as we open up even more. Larger gatherings indoors and outdoors will be permitted. Retail and shopping back to full capacity. Bars and restaurants back to regular hours. Festivals and concerts and sports events with spectators and long-term care homes will welcome indoor visits. Long-term care residents with 2 vaccines can go out for a visit or a day trip. And I want to thank everyone for their continued cooperation and commitment to public health protocols and for following restrictions. We are not clear of COVID, but because of your hard work, we can relax the rules. Now over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. Before I start, I want to acknowledge organizations such as Feed Nova Scotia and the network of food banks that they represent, as well as organizations such as Shelter Nova Scotia and others that support underhoused and homeless Nova Scotians. These organizations have continued to do their essential work supporting Nova Scotians most at need throughout COVID. And in fact, they've dealt with a significant increase in demand through innovation and creative partnerships. So again, I wanted to thank them all for the critical part they have played in our caring and compassionate COVID response. As the Premier said, we have one new case today. And I'm very pleased that cases are remaining low and we are not seeing any signs of community transmission. And so far, nearly all our new cases have been connected to travel or to a known case, and a couple of cases from Sunday are still under investigation. So things are looking good as we prepare to move into phase 4 on Wednesday. Cases and hospitalizations are low, there's no community spread, and testing is still steady at about 3,000 people a day. Most importantly, we've hit our target of at least 75% of all Nova Scotians with a first dose of vaccine, and of those, 41% have had their second dose as well. Just a reminder that if people are comparing to other provinces, these percentages are based on our entire population, not just those who are eligible. So given all of this, phase 4 of our reopening plan will come into effect this Wednesday at 8 a.m. I won't get into all the details here. You can find them on our website, but here are some highlights. Restaurants, bars, and casinos can return to regular hours and can operate at maximum possible capacity with the 2-meter distancing between groups. They can seat up to 25 people per table. But we're asking the public, this needs to be people, as you get together with others, it should be from people within your household or your already established close social contacts. It's still important to continue to be careful about the number of close contacts you have outside of your own household and outside of necessary contacts at work. Retail stores, gyms, and recreation and leisure businesses can operate at full capacity, but must continue to follow public health measures like distancing and masking indoors. Faith gatherings, weddings, funerals, and other events that are run by a recognized business or organization can now have up to 50% of the venue's capacity to a maximum of 150 people indoors and up to 250 people outdoors with distancing. And within those total numbers of 150 or 250, you can have smaller groups of up to 25 indoors or 50 outdoors of household and or close contacts. And these smaller groups don't have to be physically distanced, but there must be distance between each of these smaller subgroups. And larger venues like Centre 200 in Sydney, for example, can host multiple groups of 150 indoors, or if another organization is outdoors, 250 outdoors with an approved event plan. Masks continue to be required in indoor public places where many of these gatherings are typically held. For an informal gathering, just getting together with family or friends, you can also get together to a maximum of 25 people indoors or 50 people outdoors without physical distancing or masking. So, for example, you can now have up to 50 people, including your household and extended family and close friends, for a backyard barbecue. We're also relaxing masking requirements in certain settings. Children 12 years and younger in childcare, day camps, and overnight camps, effective Wednesday, will no longer be required to wear masks indoors. As well, all Nova Scotians no longer have to wear masks in outdoor public places like playgrounds, parks, and markets, even if physical distancing can't be maintained. However, masking in indoor public places is still required at this time. In long-term care, indoor visits can resume in a resident's room if the residents are fully vaccinated. And fully vaccinated residents can also now leave the facility to visit or even stay overnight with family. And we anticipate other residents will be able to have similar visits outside of the facility in the coming weeks as we increase our 2-dose vaccine coverage. And all of this is possible because Nova Scotians have supported a slow and steady reopening plan while we get more people fully vaccinated. You have put in the hard work, and we've hit phase 4 at the earliest possible date. And I noted earlier that 41% of all Nova Scotians have received their second dose. We are more than halfway to our minimum 75% target. And when we hit that minimum target, that's key for when we'll be able to remove restrictions and mandatory health measures like masking and distancing. Many people have moved their second dose appointment up, but there are over 150,000 people who have not yet taken this step. Now, I have to acknowledge that about 60,000 of those are young Nova Scotians, aged 12 to 17, who can only get Pfizer. And as I said last week, there is more than enough Pfizer coming for these young Nova Scotians to get their second dose. And those appointments will be mostly for the weeks of July 19th and July 26th. But that still leaves over 90,000 Nova Scotians who could get vaccinated sooner. There are a small number of people who need to wait longer for their second dose for medical reasons. But for most others who haven't moved up their appointments, maybe you're happy with the appointment you already have booked, or maybe you can't find an earlier appointment that is your absolute preferred location, or maybe you don't feel you need to be in a hurry, or maybe you don't even know that you can move your appointment up. But I encourage everyone to keep checking the online booking system to find the earliest possible appointment that works for them. And if you have someone in your life that needs help, reach out and help them to make that earlier appointment booking. And to anyone who's simply waiting for Pfizer, please do not wait. There is no real difference between Pfizer and Moderna. Both are mRNA vaccines, and both are very safe and effective, and there's clear evidence that it is perfectly fine to intermix between the two types of mRNA vaccines. You get the same end result, strong immunity against COVID-19 and its variants. And we really need everyone who can to move their appointment up. The longer we wait, the longer restrictions and mandatory public health measures will have to remain in place. And more importantly, waiting keeps you and others at risk. The Delta variant has a foothold in other provinces and countries, and one dose of vaccine is not enough to protect yourself from this variant. So this week, there are more than 50,000 available Moderna appointments across the province. And while the convention center will wind down after this week as planned, we're opening up walk-in appointments for these people who are 18 years and older at all our community clinics, starting this week at our clinics in Bears Lake and the Dartmouth Clinic at Micmac Mall. So please take advantage of these opportunities. There's 50,000 appointments waiting for you to move up and get vaccinated. If you haven't booked your first or second dose, or you haven't yet moved your existing appointment up, please do so now. Go online and book an appointment, or just go to one of the clinics that will begin offering walk-ins in the coming days. And as I said, if you know someone who is waiting but may need help, talk to them and find out how you can help them. Living normally with COVID-19 is in our reach. We are more than halfway to our minimum vaccination target. And again, once we hit that, we can start to think about removing all restrictions and mandatory public health measures. There is more than enough vaccine. There's more than enough available appointments. Now it's up to Nova Scotians. We need everyone who can to get their first and second dose as soon as possible. Many of you already have, and I thank you for that. And of those who haven't, please act now. Protect yourself and your fellow Nova Scotians, and allow all of us to start living more freely and openly with COVID-19 as soon as we can.
We'll now take questions from media in the room and on the phone. We'll do one question, one follow-up in the time we have allotted, starting with CBC Taryn Grant.
My first question is for Dr. Strang. What's your latest prediction for when you will meet that 75% double vaccinated target?
Well, a lot of that depends really on the uptake. As I said, we have those 90,000 Nova Scotians that we really need to move up. We have many people with appointments booked into October. If they don't move up, we're here having to keep with some public health measures and restrictions in place well into the fall. We don't have to do that. If everybody moves up, I think we're on target of by the end of August. So that's a big difference. But we need people to take advantage of the appointments that we have available, the vaccine we have available, and move their appointment up as much as they can.
So does that mean that if we meet it by August, we'll move into phase 5 in August, but if we don't meet it till October, we won't move?
It's meeting our minimum 75% of people with 2 doses is the most important piece. We also have to look at where we are with our own epidemiology around the country and other provinces' vaccine uptakes. But we can't even think about looking at those other ones if we don't hit our own internal Nova Scotian target of at least 75% of people with 2 doses of vaccine. So that's, as I said in my remarks, it is up to us. How do we help each other out? We can get there. We have lots of vaccine, lots of appointments.
Next, we'll go to All Nova Scotia, Madeleine Bissot. Go ahead, Madeleine.
This question's for the Premier. So PEI was the first Atlantic province to ease the mask requirements, and all across Canada, provinces are starting to say masks aren't mandatory in different circumstances. I was wondering, is Nova Scotia strict with waiting for phase 5 for ease in mask requirements, and were you aware that PEI was making this announcement?
Well, phase 4 is what we're looking forward to now, which does ease some mask requirements. So we're going to continue with our incremental approach, and we're watching very closely with what other provinces are doing and how that impacts what's happening on the ground. So we're sticking with our plan right now.
Do you have a follow-up, Madeleine?
Yes, this one's for Dr. Strang. You said in briefings in the past that young men, specifically the age 20 to 30, are lagging with vaccinations. I'm wondering, are we seeing any progress with that age group, and are you planning anything else to combat those vaccine lags?
We are seeing progress, and there's no gender difference now. It's our lowest vaccine uptakes, but it's still in the high 60% range for first doses, is in that 20 to 30 age group. But we are continuing to increase, and as I said last week, we're still getting on average about 1,000 first dose appointments coming forward on a daily basis. So we are making progress, but it is slow and incremental, and we are still continuing in our targeted approaches. Walk-ins work better. We've seen that with Convention Center, and we're expanding that walk-in concept. We're still working with various workplaces, which they have typically have younger people working in them, like Michelin and some other larger kind of manufacturing type workplaces, and other ways in smaller communities where we've become aware. We work with the local community media, with pharmacies, and create innovative ways to get access to vaccine. We're using our social media in different ways that's more targeted towards younger people.
Moving on, we'll go to the examiner, Tim Bousquet. Go ahead, Tim.
Dr. Strang, I wonder if you could just talk us through the lifting of mask requirements for the under 12. I understand that 75% of coverage for us adults gives us certain freedoms. But obviously 100% of people under 12 will be unvaccinated. So is there what's the difference there?
So if you remember, when we had masking in schools prior to the third wave, we didn't require masking for those grade 3 and under, which is about age 10, simply because of the evidence, and it's still there, that the vast majority, if there is illness in those younger age groups, it's mild illness, and they're not as effective at transmitting the virus. When we looked at age 10, when we actually talked to the people who run through community cultures and heritage, who do day camps and things like that the vast majority of kids are 12 and under. So it really made sense to just expand for a couple of years. There's no increased risk in that, and to make it cleaner for day camps and sleepover camps that the cutoff is age 12 rather than age 10. It's just a logical. Now we're out of the third wave. If we were still having kids in school, we would be removing the masking for 10 and under in school. But lots of kids we're not in school, but lots of kids are in day camps and sleepover camps, and other child care, younger kids in child care centers. So it just made logical sense that now we're out of the third wave, we go back with that age-based approach around masking.
Do you have a follow-up, Tim?
You touched on it, so I'll just follow up with you. In the fall, when we're in phase 5, will junior highs and high schools, which have high vaccination rates, will they look different than the lower grades that don't have any vaccination at all?
No, we're looking at a much more consistent approach in schools, that when we were able to get to phase 5, and hopefully we get that throughout the summer, that it's actually living with COVID. And then schools, regardless of age, look much more like school was before COVID hit. We still want to retain things like increased cleaning, increased hand washing, better ability to have people, both staff or students, not come to school when they're sick. But we're not looking at doing things differently based on vaccine versus unvaccinated cohorts.
Next, we'll go to the coast. Lindsay Armstrong. Go ahead, Lindsay.
Hi, Premier. I understand the temporary paid sick time program is set to end at the end of July. I'm wondering if you're going to extend this, given that at this point only 41% of our population is double vaccinated, and we know with the concern of the Delta variant that we need people fully immunized.
We don't have a high level of disease activity in communities, and the main reason why we wanted to have a program in place was to supplement the federal program that was in place to support workers, and there were gaps to be filled there. But we encourage employers to have strong benefits for their employees.
Do you have a follow-up?
I guess my understanding is that answer is a no. And then my next question is about an election. It seems clear an election call is imminent. I'm wondering if you can tell us a little bit about how much COVID case numbers and vaccine levels factor into your decision around timing.
Yeah, I've had that question many times. I don't have a different answer. I'm focused on continuously keeping Nova Scotians safe as my highest priority. But at the same time, over the last 4 months that I've had the privilege of being the Premier, I will continue to invest in Nova Scotians, to drive the economy and our recovery, to make sure that environment is a high priority, and to make sure that equity is. And those three things together, I'll continue to drive forward as I continue to be the Premier of this province.
We'll move on to questions on the phone, starting with CTV's Sarah Plowman. Go ahead, Sarah.
Good afternoon. This is for Dr. Strang. There is a discussion going on right now around whether or not people will need a booster shot, a Pfizer, a third shot. And I'm wondering if you have an opinion on this, and if and how this might affect, returning to normal and vaccine passports, etc.
So my opinion is that we need to get good science to inform the discussion on whether you need a booster dose. My understanding, Pfizer has some very preliminary data that's being assessed, but it's very preliminary data. And so we need a lot more scientific data that right now the World Health Organization and CDC Atlanta are both saying that there is, at this point in time, no evidence to suggest we need a third booster dose. And I think I've had lots of conversations with colleagues across the country on this, and we also need to understand that even if there is some incremental benefit from a third dose of vaccine, we have large parts of the world that haven't even had a single dose of vaccine. And ultimately, Nova Scotia, Canada remains vulnerable if large parts of the world remain unvaccinated. So that also, the global equity and protecting ourselves by collective global vaccination needs to be part of the conversation around third dose of vaccine, and where, if there is enough vaccine for third doses, where exactly is the best place to use that from a global perspective.
Go ahead with your follow-up, Sarah.
And this would be for, I guess, either Dr. Strang or the Premier. The Funeral Service Association of Nova Scotia is expressing frustration over the fact that currently the rules around visitation don't function the same way as a store, for example, or a restaurant, that there is a maximum capacity despite the fact that people can move in and out, and they would like to see this changed. Can you weigh in on that?
Yeah, I got a letter from them on Friday. I responded. I mean, we've been working with funeral services and the Funeral Services Association from the very beginning for over 18 months. And we've always working with them under the understanding and that things like a visitation would be considered the equivalent of a social event. Lots of people intermingling. And this is the first time they brought forward looking to be considered as defined differently. My response to them is that for phase 4, they're going to continue with our gathering limits based on a social event, and that we anticipate that fairly soon we'll be able to be in a position where we no longer have to worry about things like gathering limits, etc. But in this short period of time, we're going to continue with the approach that we've taken for the last 18 months around visitations as part of a number of events that are considered like social gatherings.
Next, we'll go to Global's Jesse Thomas. Go ahead, Jesse.
Thank you. This question is for the Premier. I guess we'll wait and see when an election is called, but we know one is imminent, and when an election is called, I'm wondering your protocol around these COVID briefings. Will you continue to use them, these COVID briefings, for political messaging, or will you at that time leave it into the hands of Dr. Strang to handle these briefings?
If there's a writ dropped, I won't be at COVID briefings.
Go ahead with your follow-up, Jesse.
Thank you for that, Premier. This question is for Dr. Strang. Dr. Strang, I want to ask you about the World Health Organization. They're advising against the mixing of vaccines, and I know we've been saying that they're interchangeable, but they've called it a bit of a dangerous trend with so little data. I'm wondering if you can comment on that.
Well, the National Advisory Committee on Immunization has looked at all the available data, and their position has been that, yeah, in an ideal world, when you have equal access to the same vaccines in the same time, that you should try to get the same. Your first dose should be the same as your second dose, your second dose should be the same as your first dose. But they fully acknowledge that for many people, we don't have that ability, and they go on to then recommend that the best approach, and there's data to support safety and effectiveness, is to take the first available mRNA vaccine for your second dose. If you're lucky enough and can get the same as your first dose, then take that one. But don't wait. That's what we're saying. Don't wait to match the same vaccine between first and second dose. Take the first available dose you can get. And that's the situation we're in Nova Scotia. We have lots of available Moderna, Lots of people had their first dose of Pfizer. The best thing they can do, and it's very safe and effective, and NACI agrees with that, is to take the first appointment they can get, and it's likely to be right now with the Moderna vaccine. There's nothing wrong with that. Do not wait for several more weeks in the hopes that you're going to get a Pfizer appointment. Take the first available one.
Next, we'll go to the Chronicle Herald, Stephen Cook. Stephen?
Hi, this is for Dr. Strang. I'm just wondering, as we go into phase 4, are there any areas amongst the businesses and services, continuing care and so on, are there any of those areas where we should be particularly concerned about potential spread as we ease these restrictions?
Well, I think for individual Nova Scotians, the most important thing is that understand that as we open up in phase 4, we're taking on some more risk. So as I said in my remarks, we still need to focus on things that we can do to minimize any spread. So we have more activities, but be careful how many close contacts you're adding into your life. We have contacts in our household, we have contacts at work. If we're adding more social contacts, think about how many you're actually adding in, under what circumstances, and try to keep some consistency in those. We're still requiring people to have physical distancing and masking in certain places because that helps prevent the spread. So we can't act like COVID is all done with. We are opening up, but we still have to have a strong sense of caution and respect for this virus.
Go ahead with your follow-up, Stephen.
And just wondering, do you think the odds look good for perhaps entering phase 5 before the end of July, or is it pretty much that's what's on target for reaching that minimum 75% double dose at that time?
The most important thing is, as I said earlier to another question, is they hit that minimum of 75% for 2 doses. We believe we can do that by the end of August, but that depends on that 90,000 Nova Scotians actively moving their appointments well up. It also depends on unvaccinated Nova Scotians taking advantage of our walk-in opportunities to come in and get your first dose and then your second dose.
Moving on, we'll go to the Canadian Press. Michael Tutton. Are you there, Michael?
Yeah. Dr. Strang, some epidemiologists talk about 90% needed to deal with avoiding a 4th wave of the Delta variant. What's your view on that kind of a number?
Well, it depends whether you're talking about the overall population. I think that 90% is people are typically talking about the percent eligible. So when we talk about 75%, Nova Scotia, we always focus on our percentages based on the entire population. Because and then my view on this is that the virus doesn't care whether you're eligible for vaccine or not. It cares whether you're immune or not. So we focus on what's the percent and a minimum percentage of Nova Scotians, regardless of their age group or their eligibility, who are immune based on vaccination. So when we do that, so the minimum of 75%, that gives us, if you look at if we hit 75%, which we are now for 1 dose, that means that roughly 85% of eligible Nova Scotians who have received their first dose. And so we're starting to get closer to that 90%. So we've always chosen a more aggressive target here in Nova Scotia than other provinces. And I believe we can get to 80% as a minimum of all Nova Scotians getting their 2 doses, which would then put us around that 90% mark of eligible. So I think we can get there. The epidemiologists are right from the perspective that you need a high vaccine coverage rate to prevent spread of the virus. You need 2 doses because of the Delta variant, and the higher your vaccine coverage rate, the greater level of protection, the stronger that wall of protection is. So I believe we can get there by we minimum 75. I really believe we can get to 80% of all Nova Scotians, which puts us at around 90% of eligibles. I'd like to go even higher.
Do you have a follow-up, Michael?
Yes. Nonetheless, the pace across Canada is really slowing for the first dose, as you and the Premier are pointing out. What is your thought on whether it's time to think about copying the census or other mass mobilization efforts, house to house? You have a list of everybody who's unvaccinated, calling them up, going to their door if they're around, offering them a shot on the spot, a clinic down the street. At what point do you move to that stage?
Well, we're not at the point of reaching out to people individually. I think you got to be careful that you don't become intrusive. But we've moved to the walk-in model. We've got all sorts of messaging, briefings, media, social media. I'd be very surprised if there's any Nova Scotian who's not aware of the opportunity to get vaccinated. And we're using walk-ins, and I've talked about other creative ways through workplaces and other things that we're actually making sure that vaccine is readily available. And we continue to look at our data, both on age group, and I've talked about here previously, especially in some smaller communities where we have lower vaccine coverage rates. We're going in with public health, working in partnership with community leaders, community media, the local pharmacy clinic, and really targeting very kind of really localized geographic areas, and that's paying off. We're seeing when we move in, we get a big bump in that little small community, and we'll continue to do this very targeted approach. But I'm not sure that reaching out to people individually, which becomes rather intrusive, is actually going to have much benefit. They're aware of it. We just need to make sure that they have very easy and ready access to vaccine.
Next, we'll go to Sarah Derry with Radio Canada. Go ahead, Sarah. Sarah, are you there? We'll move on. CKBW, Evan Taylor. Evan, are you there?
Yep.
Go ahead, Evan.
Premier Rankin, this past weekend there were 34 code criticals called in various parts of the province. The health minister said on April 6th that Nova Scotians could expect improvement on that front in around a month or two. Obviously not seeing that improvement. I'm wondering if you can explain if it's related to the third wave of COVID or if there are other mitigating circumstances.
I don't have localized information on why that would occur. I know we are making progress in implementing the Fitch report. There are a number of other initiatives to ensure more effectiveness of our services. So I would encourage you to speak directly with the department to get the details of those incidences.
Do you have a follow-up, Evan?
I do not.
We'll do one final check-in for Sarah with Radio Canada. Sarah, are you in the line?
Hello, I'm afraid she had to leave. This is Adrian Brand for Radio Canada.
Okay, go ahead with your question.
Yes, my question is for Premier Rankin. You said that you waited for phase 3 to end before talking about your vision for the province. And now that we are reaching the end of phase 3, should Nova Scotian expect a restart plan from you soon?
So I've been talking about my vision for several months now since I've been the Premier, and before that, where I see the province going next. Now that we are getting safer, we're going to continue to talk about what our recovery looks like so we can grow an economy that's more inclusive, that's more sustainable, and all of you see these announcements coming out. I'm going to continue to invest in Nova Scotians and make sure that people know my vision and what I stand for.
And do you have a follow-up?
Yeah, since June 15, your government has made 32 announcements for the funding of various projects around the province. That is one announcement a day. So are you already on the campaign trail? And if not, why so many announcements now?
Actually, we've been active since I've came into this office, minus the shutdown in the month of May and the beginning of June. As soon as I got into office, we had a budget within weeks. We had a throne speech. We were in the legislature, and I've been investing in healthcare, in a myriad of different issues that I felt like we needed to pay attention to. Housing. We made an awesome announcement today on how we address systemic racism in our justice system, and that's what I'm going to continue to do.
And that's all the time we have for questions today. Premier?
Thank you. I've been out and about around this province, and it is wonderful to see the communities coming alive. Campgrounds are full, boardwalks and beaches are bustling, shops and restaurants are serving a steady flow of customers, and families and friends are reuniting. It's been so nice to see pictures of people enjoying those long-awaited hugs. Lots of smiles and laughter. This is a positive time in our province. We have a lot to be grateful for and a lot to be proud of. I want to thank all Nova Scotians for continuing to follow the restrictions in each phase and for continuing to follow the protocols, including wearing masks indoors. I know it hasn't always been easy, especially for families who have had to grieve a lost one over the last little while. As we open up more and prepare for the fourth phase, we cannot forget the lives lost and hardships felt. COVID has taken its toll. But if we continue to increase our vaccine coverage, we can learn to live with the virus. and I want to encourage all Nova Scotians to schedule their vaccine appointment as soon as it's available to you. Do this for yourself, your family, and your community. We are better when we work together.